Let me briefly give you a short overview of my presentation. Firstly, I will give the objectives of this plenary session and also objectives of the study that we have already conducted, namely integrating epidemic and pandemic preparedness into disaster risk reduction. I will also briefly mention the methodology that we have employed, allocation of tasks, and also will touch on the COVID-19 outbreak in Sri Lanka, a synoptic analysis focusing on trends, impacts, and risks. And then our panelists will conduct their presentations, and after that we will have a question and answer session before conclusion. The objectives of this plenary session is to communicate the findings of the study among key stakeholders and discuss the relevance of such findings in arriving at national and subnational level policy decisions, to validate the findings of the study based on input given by key stakeholders, drawing on their expertise and field experiences. Also, the objectives of the study that we have conducted, integrating epidemics and pandemic preparedness into disaster risk reduction. I'm not going to read them all, but let me highlight one or two objectives. How risk works, especially how risk cascades with unexpected consequences, and how countries can build capacities to manage this, and also how can countries prepare for early better recovery that prevents the emergence of new risks with early and rapid actions for DRR related organizations in line with the Sendai Framework for Disaster Risk Reduction, call for building resilience for biological hazards and pandemics. Without taking much time, let me also introduce very briefly the methodology that we have employed to collect data for our study. So basically we collected secondary data from different organizations, and also we had key informant interviews with health sector, national level disaster management authorities, subnational level disaster management authorities, private sector, INGOs, international organizations, and local authorities. And we have allocated our work according to the given structure. So University of Colombo, we collected the information with regard to pandemic and epidemic preparedness in DRR, and also University of Moratuwa, role of health authorities in pandemic and epidemic preparedness, and also University of Huddersfield gave the leadership plus global collected information with regard to global perspectives of pandemic and epidemic preparedness, and also based on more focused on UK approach. Now if you want to get more information on the findings of our research, you can access the position paper that we have already published, namely the integration of epidemic and pandemic preparedness in disaster risk reduction planning in Sri Lanka, and we have already given the web page, and the document can be easily downloaded. With regard to the question of trends and impacts and risks of COVID, as all of you know, actually we are focusing on COVID first wave in Sri Lanka. So as we know, on 31st of December 2019, an outbreak of pneumonia of unknown reason was identified and reported from the Wuhan city in Hubei province of China. And also on 7th of January 2020, this was diagnosed as the novel coronavirus. On 11th March 2020, it was recognized as a pandemic. When we explore the trends, now here you can see how the cases have already been developed. As of yesterday, the total number of 33,478 confirmed cases, 152 deaths, and over 24,000 recovered and discharged. Now, when it comes to the impacts, as all of you know, there are health impacts, economic impacts, and also social impacts. One could argue that the vulnerable could be more, the vulnerable groups are highly affected due to this, and they could be more vulnerable as they have to cope with multiple sources of vulnerabilities. Nevertheless, the government of Sri Lanka approach to combating COVID-19, I would like to draw your attention to some of the salient features which we have identified based on our study. Proactive measures, like a day before the first confirmed case of COVID-19 was identified, the National Action Committee for COVID-19 was formed. And also measures were taken to control the transmission of the virus from travelers arriving in Sri Lanka. There were some stringent features. There were a ban on all public gatherings, closure of all education centers including schools and universities, discontinuation of non-essential services, enforcement of an island-wide curfew with a work from home option for the population across the country. And also there is a multi-sectoral approach. The government of Sri Lanka's approach to minimizing the spread of pandemic broadly focused on 4 lines of operations: military, police, intelligence, medical and healthcare, psychological, economic, and community well-being. So with that short, brief intervention, let me now invite Professor Dilanthi Amartunga, Professor of Disaster Risk Management at the University of Huddersfield and the co-director of the Global Disaster Resilience Center of the same university, to make a presentation on integrating epidemic and pandemic preparedness in disaster risk reduction, snapshot of our interdisciplinary collaborations. Over to you, Professor Dilanthi.
Thank you very much, Nishara, for that introduction and also for this very important session. I hope, can all of you see my screen and can all of you hear me? Yeah. Thumbs up, please, if you can. Chandana, can you hear? Right, okay, all right, okay. So what I'm going to do now is to give you a kind of a snapshot on type of interventions that we are doing at the moment, particularly with our Sri Lankan partners. So this is actually the latest from the UK, and as you can sort of see, it's a very, very alarming picture, and this is actually the update as of last night. We get daily updates. So people tested positive was daily. Yesterday it was 20,263, and deaths 232. Patients admitted 1,693, and also virus test conducted daily. Yesterday, 312,273. So you can actually see how serious the situation is. And to your right hand side, you can see I just took the snapshot of where I live just to sort of tell you how the situation is. It says current alert level is very high alert, and this was actually last night. And you can sort of see the situation. So this information is available for everybody, irrespective of where you live in the UK, to test the actual status. So I don't need to emphasize further how important the time that we all live in and the actions that we all have to take in this regard. I just want to emphasize the economic impact due to the coronavirus. Just to sort of give you a kind of a bit of a comparison, this is actually the UK situation. The coronavirus outbreak has impacted the economy in many ways, particularly from lockdown restrictions to shutting down businesses, limits on mobility, and also sort of with those, the economic impact has been severe. I think that is actually an underestimate, and if I sort of say, if I don't say that. And also sort of it is the magnitude in that sense of the recession caused by the coronavirus outbreak is simply unprecedented in modern times. So UK's GDP was 25% lower during the depth of the crisis in April this year than it was only 2 months earlier in February. So you can see the movement of GDP. Imagine 25% minus in 2 months. And also, even though, but after spring and moving into summer, the things actually settle down a little bit, reflecting the opening of the economy and demand from the lockdown period. So during that period, the GDP picked it up, and it was only 8% lower in September. But again, then the second wave. So with that, the forecast for GDP point towards a large decline in 2020. For example, the Bank of England in early November forecast only a forecast UK GDP growth of minus 11% in 2020. This has never happened in the recent history in the UK. So the graph, again, I took it last night, very much up to date. You can see the situation. So of course, the economy has picked up a bit, but a long way to go. So I think in that sense, I think it is fair to say that the health crisis stress test our ability to cooperate, learn, and adapt in the face of deep uncertainties and rising risk. So in that sense, COVID-19 is much more than a public health emergency. That is why I shared with you some of the latest economic impact statistics from the UK. So COVID-19 disaster is what the international scientific community has recognized for years. That is, in an increasingly interdependent world, our lifestyles, our choices mean that hazards are spread throughout communities, societies, and economics in very complex ways that we ever imagine. And also this issue about systematic and cascading risk. So in that sense, as we all know, I think since the commencement of the symposium, there have been a lot of discussions about the topic. Dealing with multiple challenges is not easy. We all recognize that. However, there's a high need to take steps to prepare ourselves to face this unknown. So in the UK, again, just to sort of reflect, to share with you the role of the health services within the overall DRR context in the UK. So you can actually sort of see in the UK that the health sector is very much part of the overall DRR strategy. As you can sort of see, the country is directly linked to the global and regional frameworks, regulations, and partnerships. And you can see the health sector is very much part of a multi-sectoral partnership alliance, leading to a multi-sectoral coordination platform. So in that sense, the role of the health sector and their role in disaster management has been specifically identified, acknowledged, and formalized. So this is actually one of the very important points I want to emphasize as far as the UK status is concerned. So again, this particular, the heading, disasters don't stop for a virus. I think we all need to be very mindful about that. And I have actually shared with you some of the paper clips from the UK media. The first one, it says, flood asset repairs continue during the coronavirus pandemic. So just because that we are facing the corona pandemic, we can't forget about all other natural hazards and everything else that is happening around us. And also, as far as pandemics and epidemics are concerned, particularly in the Sri Lankan context, it is not only COVID, then we have dengue and the malaria is actually heading up. So there are so many things to be looked into. And also you can actually sort of see various news clips which says 3.5 million UK households at risk of double disaster from flooding and COVID-19 pandemic. So these are the issues that we all need to be very mindful about. These are real, not hypothetical. So dealing with dual challenges, flood risk management in the during the pandemic is not easy. You can sort of see again this picture to your right was taken a few months ago in the UK. So in that sense, what is happening in the UK is, as I emphasized before, along with the COVID crisis, the respective agencies are taking all efforts to make sure that the warning services are in place as far as other natural hazards are concerned. So you can sort of see this is actually the snapshot of the flood warning service. The agency in charge is environmental agency, so they always sort of actually keep people up to date about the status. And particularly you can see about the flood defense work. It very clearly says what you need to do during the coronavirus pandemic. So it is really important that this up-to-date information is shared with the community. This is one of the important points I want to emphasize. So with this background, what the UK had done is there have been unprecedented investment on research. So which is where the education sector is very proud about in the UK. So there have been a lot of funding invested in COVID-19 related research on the medical front, interdisciplinary front, multi-sectoral fronts, and so on and so forth. So in that sense, you can actually sort of see what we did was, together with our partners in Sri Lanka, we were very quick in taking action, and we submitted several research proposals. And I must say, this particular proposal, very prestigious, funded by the UK Research and Innovation, we have been successful. So again, having key stakeholders from Sri Lanka, Ministry of Health, Dr. Hemantha Herath is a key partner. Disaster Management Centre came on board, various government institutions, and also in the UK, the Public Health England came on board, IOC UNESCO came on board, UNDRR came on board. So I was actually having a lot of hopes when I coordinated this proposal. So it was very good to see that we were successful. So this is actually one of the first proposals that were funded as part of the government support towards COVID-related research. So this research, again, I'm not going to go through what Nishara is going to cover because that was a different project, but this is actually, we call it second project, so COVID-2. So here what we are actually doing is we are again exploring some key questions again in a interdisciplinary consortium, having sociology, the scientists, the civil engineers, the public policy officials, health officials, everybody will be sitting around the table in exploring these research questions. So which is very, very interesting, and we are really looking forward to take action on this project. And then we have another project, actually, we call it Integrating Pandemic, Tsunami and Other Multi-Hazard Preparedness into Early Warning and Urban Planning. So this has a very specific focus towards urban planning. And you can see the collaborators, the State Ministry of Rural Roads and other infrastructure is very much on board, and also urban development sector in Sri Lanka is very much on board, and also globally, UNDRR, and also they are Making Cities Resilient initiative, looking into how to integrate pandemic and other hazards into early warning, and particularly towards urban planning. So this project is also underway as we speak. So the project objectives of this particular initiative is to understand the current status, best practices of COVID and biological hazards, and also to understand, to explore the ways that we can mainstream these hazards preparedness into urban planning. And in this particular instance, we are specifically looking into tsunami-prone areas. That means the coastal region. But having said that, we are now thinking of incorporating inland as well. So that needs to be discussed in detail. And also, Sita, we are going to discuss, I think the point 3 is very important as well. We are going to discuss about the economic impacts of COVID-19 across different parts of the economy, and to explore ways to enhance economic preparedness and mitigate impacts. In this instance, particularly in Sri Lanka, the Ceylon Chamber of Commerce is very much on board as a key partner. So we have a series of activities that we are going to put together in carrying forward this action. And also finally the main product will be kind of developing a vision paper on disaster risk reduction for future urban spaces. So that is actually what we are going to do. And I think one of the important points I want to emphasize here is we have 3 funded projects within a very short period of time, I think, which is commendable in my view. To the entire partnership, we have a lot of partners from Sri Lanka and also from elsewhere, University of Colombo, Moratuwa, Ministry of Health, Disaster Management Center, several other ministries. So this is very much teamwork. So I think we all need to be very proud of ourselves for being in this position, having been successful with three research proposals, which bring in all these different stakeholders together. And this morning, again, I actually was invited to present at the Europe and Central Asia annual meeting for UNISDR, where head of states of 56 countries attended. So I did my presentation this morning. Again, I shared some of the initial findings from our work. So I think we all need to be very much proud of this work. Again, there were so many questions from a lot of head of states about these developments in Sri Lanka. So I thought it is actually quite a good platform. So this happened actually this morning via Zoom. As far as outputs are concerned, so we have actually done several outputs on open access. They are available to view. And of course, we are doing a lot more products as we speak. And of course, Dr. Nishara Fernando, the chair of this session, emphasized we are just launching the initial position paper today, which has now been added to the website, which can be read freely by anybody. So in concluding, what I need to emphasize is that COVID-19 pandemic has demonstrated that the consequence of systematically underinvesting in resilience. I think it is fair to say that a lot of direction has been towards response, somewhat bit ignoring about the risk reduction and the resilience angle. So this current situation has been a huge eye opener for all of us. So in that sense, the cascading nature of disaster risk, where one disaster can rapidly lead to another, coupled with, for example, insufficient investment in disaster risk reduction, and it makes it critical that trade, food, energy, transportation, and health rely on increasingly vulnerable to hazards such as COVID-19. So in that sense, this crisis also represents, but having said that, among all the negativity, this crisis also represents an unprecedented opportunity for all of us, even a necessity to solve some of the historical challenges. And that is where we are trying to do with our joint efforts. Thank you very much.
Thank you, Dilanti. Let me invite the next speaker, Dr. Hemantha Herath, the Deputy Director General of Public Health Services, Ministry of Health, Sri Lanka. Dr. Herath will provide a brief outline of the role played by the Disaster Preparedness and Response Division of the Ministry of Health during the COVID-19 pandemic in Sri Lanka. Over to you, sir.
Thank you, Dr. Nishara. Members of the head table and the panelists, and ladies and gentlemen, good evening. Role played by the disaster preparedness and response division of the Ministry of Health as part of the COVID response in Sri Lanka. I think it is most of the time in Sri Lanka, most of the people are aware, but sometimes we also have seen that it is not portrayed to that extent in certain situations when it comes to the real potential as well as the role played by the Ministry of Health and the disaster preparedness and response division. Basically, most of the activities that we have carried out are not necessarily, and most of the time it was not after the occurrence of this pandemic. We did our activities prior to the reporting of this pandemic, well before, probably years before the occurrence of this pandemic, because pandemic preparedness was integral part of the Health Ministry Disaster Preparedness and Response Program. We have identified the potential and the possibility and probability of biological hazards as well as pandemics or at least outbreaks of infectious disease of this nature from time to time. Before the establishment of the disaster preparedness unit, I personally experienced a few pandemics. For one example is in 1995, when I was working as a young medical officer of health. There was really an outbreak of plague in India, which spread into many countries, including Sri Lanka, where one case of bubonic plague reported in Colombo Harbour. From there onward, I happened to be the port health officer in the Colombo Harbour when the next pandemic came, and that is the SARS pandemic, where the first case of suspected, so it's really a suspected SARS case reported from a cruise liner that was moored in the Colombo Harbour. At that time, we really saw the level of our preparedness for pandemics of this nature. The readiness of the health services were really tested without causing much problems because it was only a suspected case and not a real case. But unfortunately, we had a very bad experience where how that patient was handled by different hospitals, and not only in the government but also in the private sector, because the people were not really ready for epidemic or outbreak of infectious disease of this nature. Somehow or other, this opened the eyes of the health authorities, and the infectious disease hospital was prepared, and finally it was converted to a reasonably well equipped hospital to face this kind of sicknesses of infectious or nature, so that we will be able to handle such patients effectively compared to what we fared during the SARS epidemic. Especially when the next threat came, was the H5N1 or the bird flu threat, which luckily did not come to Sri Lanka. But from there onward, during that time, the influenza preparedness technical committee was established in Sri Lanka, and that was a relatively high level committee that started to meet once a month, probably around 2005, if I can remember, which continue to meet monthly even now. And that was another, the pandemic preparedness mechanism that established in Sri Lanka, which helped us a lot to develop our preparedness level. Then after that, you know that H1N1 epidemic came, and the Middle East corona virus outbreaks came, and also the Ebola outbreak in African countries. All these had, luckily, though we did not get cases in Sri Lanka, our alert levels were increased in several occasions in relation to the cases reporting from different countries. And our systems were really strengthened from time to time based on the risk that we perceived from time to time. And in 2019, it was another landmark year when suddenly we were faced with an unfortunate incident on the Easter Sunday, where the risk of getting biological, chemical, radiation, and probably nuclear threats into the country was highlighted by several agencies. And even we know that even before this threat came, from January onward, the Disaster Preparedness and Response Division started our activity to improve or increase our capacity, especially not necessarily the disaster preparedness unit, but the health system in the country. And we had a series of training programs throughout the year 2019, covering many aspects of chemical, biological, and radiation and nuclear threats that we might at that time we perceived. And as a result, not only the health sector, but also the security forces, police, the other non-government organizations involved in the type of health service delivery and the security first responders, all these stakeholders were summoned to single forum, and we had workshops, we had training programs, and as a result, we were ready. But at the same time, the WHO supported us in great way to strengthen our physical capacity by providing the equipment, especially the personal protective equipment, and giving training to those who are engaged in especially the first responders. And because of that, those activities, by 2019, we were fairly ready to face any kind of initial threats, at least to face the initial phase. And when the COVID-19 threat came in late 2019, and by late January 2020, we had we were confident that the available facilities, though we did not get cases at that time, we were fairly confident that if a case comes, we will be able to handle it. And within 2-3 days, the first case came. That's a Chinese lady, and during that time, without getting into panic, what happened in 2003 when the first SARS came, suspected SARS patient was well, our hospitals were ready and our system was ready to transport this patient to the relevant, the IDH hospital, and also to do the necessary tests using the Medical Research Institute. And we were successfully managing that patient. And after that, we had a pause of 1 month almost to see the next or the real indigenous case of COVID. And from there onward, I think it is the history. We were able to carry out our response activities, and disaster preparedness and response division from time to time. We our role. Our activity and our main role was to do the preparedness activity, which we did successfully before the occurrence of this disaster. And from there onward, we did the coordinating part and gap filling role. That is, whenever there is something to be done, and if there is an agency that is responsible to carry out that, we try to strengthen them, we coordinated with them. And if there is no urgency to take over or carry out any specific activity that need to be carried out during this response, we took over. And then gradually we identified the proper agency to carry out that, and then we handed over, and we were waiting to undertake any other activity for which we might not initially find a person to do or agency to do it. So this kind of gap filling, strengthening the institutions and other activities were carried out this unit, and we continue these activities, and we this unit comes under the Secretary Health, but supervised by the Additional Secretary Medical Services, and we do our activities under the instructions of the Director General of Health Services, and we have a very energetic team, and that's how we facilitated the pandemic related preparedness activities as well as the response activities during the past probably the 11 months in the year 2020. Thank you.
Thank you, sir. Let me now invite Major General Sudhanta Ranasinghe, who is the Director General of the Disaster Management Center, Sri Lanka. He will speak a few words elaborating on the role played by the Disaster Management Center during the COVID-19 pandemic in Sri Lanka. Over to you, sir.
Good evening, everyone. I will brief only on the areas covered by Disaster Management Center of Sri Lanka, and Dr. Herath gave a complete description of the health side of it. So I will only talk of the action done by the Disaster Management Center, and I'll try and be very brief on my talk. So first line would be, no one is safe until all are safe. I think that is the motto behind the COVID-19 now. So in Sri Lanka, when this came in end February, and when we identified this in March, DMC, or the Disaster Management Center Sri Lanka, was the first to respond on this issue. And I still remember the first week of March, we had our first meeting and discussion with health authorities and all connected authorities, and we discussed the way forward and do's and don'ts. And I remember Dr. Herath was there as one of the main members, and we have Dr. Paba also advising us on our way forward. And with that, we had our initial programs planned, and we planned it right down to the local levels. And as always, disasters comes in packages. For in Sri Lanka, COVID-19 came together with southeastern monsoon, and we had the problem of Sena caterpillar attacking our cultivations and agriculture farmers in the north and north central. So mitigating all three together was a mega task for disaster management, as we are the authority and main responsible agency for all disasters in Sri Lanka. However, since we have our system right down to the local levels, we manage going right down to the local levels and identifying all the authorities. Then coming back to COVID-19, as it is the subject, so I will not talk of balance parts seriously. Sri Lanka declared this as a health emergency or the medical emergency, and security forces of Sri Lanka, headed by Presidential Task Force head on the COVID-19 task force, the commander of the army, took the lead on mitigation task of COVID situations. Having said that, it was Disaster Management Center who first came forward with 117 call center and our Emergency Operations Center to coordinate with health authorities, hospitals, and then ambulance services, 1990 ambulance services, and all these people came together, and Disaster Management Center developed the situation and coordinated with all the other authorities, and we promoted the development of institutional guidelines. And together with institutional guidelines, the health guides came in, then school action plans and preparedness and guides for schools were also developed. Then we had to face the elections with COVID and monsoons. So for that, DMC took the major role, and we had preparedness and guidelines developed and given on the conduct of the election. Then we have the school examination. Again, it was Disaster Management Center who took the lead and conducted awareness programs and all the do's and don'ts and advices on school examination, A-level examination. And then we had Buravi. The cyclone came in, and we faced the cyclone also, even with disaster situations, the flood situations, COVID, dengue, all that, we faced all that. And the issue is how we did all that. That's mainly because the Disaster Management Center of Sri Lanka has our own internal practical systems of going down to the last man, last mile situation, going down to the local level. So we had our planning and preparation division, we have our mitigation division, then we have our emergency operation division, then we have our call center. With all that, we had our plans earmarked, mapped out, and details mapping on, and then data collection and analyzing and studying data, and then developing our artificial intelligence on where, when, how, and by whom. These things were conducted, coordinated. So it did not become a very serious task for Disaster Management Center, as we knew exactly what it was coming in. Health authorities advised us. Then we knew exactly who will do, where, and what they will do, and how they will do. This was given to all the divisional levels. Then coming down to the social issues, of course, we had number of national events, like we had National New Year, the Sinhala New Year, then we had Deepavali, then we are now coming on to the season, the Christmas is coming in, 31st night is coming in. The health protocols, guides, restrictions are already been advised and given, and people have been told what to do and what not to do. I still remember when I was talking in media during Sinhala New Year period, I said, don't carry the plate of Corona from home to home. Again, this is the same thing. Don't carry the plate of Christmas from home to home on 25th December. This is the message we have to give, and the message is very particularly given to all the people by media. Then coming on to the social support and developing the livelihoods of people. It was Disaster Management Center together with Poverty Education and National Task Force of COVID, together with honorable authorities, whoever who was handling that. We developed the systems of buying certain things, buying the products of poor farmers from the local levels, then organizing and coordinating their agriculture products to come to main markets, and coordination with those deliveries with district secretaries, then divisional secretaries, by our district additional assistant directors, with the support of security forces were also conducted. So all in all, I think Disaster Management Center did our role, and we are continuing to do our role amidst all odds, and we are now planning and facing preparing ourselves for northeastern monsoon. And there also we have our special district plans done, and as you all know, each and every district has our own district quarantine center for worst case scenarios. Then we have the system of home quarantine, looking how we look after home quarantine people. Then we developed a new system of friends and family system where people will not get clogged and cluttered in health safety centers rather, so they will go on the new system of friends and relatives, so that that COVID issue won't get spreaded. So that those controls are being done, and together with the health authorities, security forces, and all the other stakeholders, disaster management center is ready and prepared for any eventualities. And thank you very much for the invitation.
Thank you, Major General Sudhanta Ranasinghe, Director General of the Disaster Management Center, Sri Lanka. Let me now invite Ravindu Jayasekara and Naduni Jayasinghe to make their presentation on existing disaster risk reduction planning and epidemic and pandemic preparedness. Over to you, Ravindu and Naduni.
Thank you, Doctor. Hope you all can hear me. Okay, in this section, we are looking into two major aspects. The first one is who are the main stakeholders that are currently involved in pandemic preparedness planning in Sri Lanka, and who should be involved in this process. The second one is the scope for epidemic and pandemic preparedness in existing DRR planning. So moving on to the stakeholders who are currently involved in pandemic and epidemic preparedness in Sri Lanka, we have looked into several existing plans that are addressing epidemic and pandemic preparedness. So these are the plans that we have looked into in our study. We have used this plan to identify who are the stakeholders that are currently involved in preparedness planning for pandemics and epidemics. So coming to the legal framework for epidemic and pandemic preparedness in the country, the Quarantine and Prevention of Disease Ordinance number 3 of 1897 makes necessary legal provisions for this process. So in most of regulation framed under this ordinance, the Director General of Health Services has been assigned as the proper authority for facilitating these activities. So however, the DGHS has delegated some of his powers to the regional and divisional levels as well. So according to these provisions made by this legal framework, the health authorities in the country play the central role in preventing and mitigating risk pertaining to biological hazard. So it is clear that the risk of epidemics and pandemic should be required to be managed by a process dominated by the health sector, and where the Ministry of Health in the country should play the central role here. So there we have looked into what are the specialized units functioning under the Ministry of Health. So these specialized units are functioning as a focal point for special aspects and function related to preparedness for epidemics and pandemics. As an example, Disaster Preparedness Response Division functioning under the Ministry of Health. So they are acting as the central authority for coordinating health-related activities in this process. So furthermore, we have identified who are the health-related other stakeholders in this process. So likewise, Department of Animal Production and Health, then College of Community Physicians. So at the national level, the coordination between these stakeholders have been maintained through like national committees such as National Technical Committee for Avian Pandemic Influenza Preparedness. So furthermore, we have looked into, in addition to the mentioned health stakeholders, the National Emergency Operation Plan developed by the Disaster Management Center, mostly known as NEO. So they have identified who are the stakeholders that should be involved in carrying out emergency operation in an event of an epidemic. So we have looked into how these stakeholders have been connected with each other in this process using social network analysis. As you can see here, this is the way that they are connected in each other carrying out this operation procedure. So especially like DMC, then the local government authorities and triboses have been like vested with the major responsibility here. So during our study, it was clear that the health sector has to play a major role in preparedness planning for epidemics and pandemics, since they are the technical experts for these such activities. But according to recent recommendation made by global agencies such as WHO, UNDRR, the epidemics and pandemics should not be seen as only a health issue. So they have suggested there should be a multi-sectoral approach in this regard. So going with this global recommendation, most of the key informants during our study suggested that the involvement of NGOs, then private sector organizations, then global development partners, community-based organizations should be more improved and encouraged in this process. So as an example, there was a suggestion made by one of key informants to integrate the pandemic and epidemic preparedness into occupational health and safety procedures in private sector organizations. Furthermore, we have, like in here, we have identified the coordination between the stakeholders in this process. It's a very important aspect here. So what we have identified here is mainly the stakeholders of this preparedness planning are connected with each other through national level committees, such as National Advisory Committee on Communicable Diseases. So furthermore, we have identified that in preparing and responding to these infectious diseases, depending on the status of the disease, like if there is a foreign disease coming to Sri Lanka, the quarantine unit becomes as a main stakeholder in this process. So likewise, the responsible unit varies with the status of the disease here. So during COVID-19, like there had been a close collaboration with the authority of Director General of Health Services and the other public health authorities. Like so, therefore, there have been like several benefits that they have gained from this strong link between these authorities. So furthermore, here I would like to elaborate on stakeholders who are involved in cascading impacts related to biological hazard. So we have taken this COVID-19 as a case in point. So currently the National Disaster Relief Service Center, known as NDRSC, is acting as the authority which have the power to coordinate provision of disaster relief in the country. But we have seen that there have been 3 presidential task forces appointed by the president to address the cascading impacts at the national level. Furthermore, we have in our study, we have taken this Tamankadua district secretariat area as a case study for our study. Like we have identified what are the district level responses taken by the relevant authorities, then divisional level responses like distribution of 5,000 rupees for unprivileged families, then ensuring access to essential services, then supply of food, dry ration to other institutions likewise. So there have been several responses taken at the divisional level also. So from up to what I have presented now, like we have derived several key insights here. So first one is like there should be a multi-sectoral approach towards the preparedness planning for biological hazard. So we have identified that as one of the key points here in regards to my stakeholders who should be involved in this process. So furthermore, we have identified that there should be like when new structures have been established during COVID-19, where existing structures could have been effectively utilized. So therefore, there should be standard operation procedures to formulated to use existing structures in preparedness for biological hazard here. So furthermore, I would like to present that we have identified that the attention should be more paid towards building resilience rather than addressing cascading effect in relief and response. So from here, I would like to invite Naduni to continue from here.
Thank you, Ravindu. I'll share my screen. I hope all of you can see my screen. Right. So in this section, I'll be talking about the extent to which epidemic and pandemic preparedness has been addressed in existing disaster risk reduction planning in the country. And before that, I'll be giving you a brief overview of the existing disaster risk management institutional framework of the country. So in this regard, the Sri Lanka Disaster Management Act of Sri Lanka provides a legal framework for disaster risk management in the country. And this act has also provided for the establishment of the National Council for Disaster Management, which is the supreme governing body of disaster management in the country. And the Ministry of Disaster Management acts as the main decision-making body of disaster management in the country. And it is the Disaster Management Center that acts as the executing agency of the National Council for Disaster Management. And it also coordinates the countrywide DRM program at the national level. Although the DMC coordinates the countrywide DRM program at the national level, this responsibility has been decentralized to the district disaster management coordinating units, which are the focal points for coordinating the disaster risk management program at the subnational levels. And in addition to this, the Sri Lanka Disaster Management Act actually provides for the establishment of subnational level disaster management committees and the formulation of subnational level disaster management plans, which is indicative of a deconcentrated approach to disaster management in the country. Now, moving on to the extent to which epidemic and pandemic preparedness planning has been taken into consideration within existing disaster risk reduction planning in the country, it is important to pay attention to the definition of the term disaster provided in the Sri Lanka Disaster Management Act number 13 of 2005. As you can see on the slide, biological hazards, particularly epidemics, have been taken into consideration in the interpretation of the term disaster, and therefore all the legal provisions of this act are also applicable for a situation of an epidemic. Similarly, the Sri Lanka Disaster Management Plan also emphasizes on the importance of taking into consideration biological hazards in disaster mitigation activities, as you can see. So evidently, at national level, policing and planning, preparedness planning and carrying out disaster mitigation activities for biological hazards has been acknowledged. But there is no adequate evidence to prove that this has been implemented in the country to a significant extent. For example, a risk profiling activity for Sri Lanka was carried out with the objective of generating spatial information on various types of hazards. And in this risk profiling activity, priority was given to 5 types of hazards. And as you can see, biological hazards have not been taken into consideration. And also, this was also confirmed during key informant interviews. For example, a representative from the UNDP said that in preparedness planning activities conducted during his career, epidemics, although a serious issue, have not been prioritized. Now, moving on to the extent to which epidemic and pandemic preparedness planning has been addressed in subnational level DRR planning and implementation. During our key informant interviews with subnational level disaster management authorities, we identified that biological hazards have not been adequately addressed in subnational level disaster management plans. And this is a quotation from one of those officials that proved this statement. And this is another quotation that acts as evidence for what I just said. And on a more positive note, though, we were able to identify that many of the subnational level disaster management authorities have realized the importance of incorporating biological hazards in their disaster management plans in the future, particularly after the COVID-19 pandemic. Moving on to the institutions and stakeholders involved in epidemic and pandemic preparedness and response within current disaster risk reduction planning. The National Emergency Operations Plan basically outlines the stakeholders who should be involved in emergency operations and response to epidemics. And also, the Sri Lanka Disaster Management Plan. The Sri Lanka Disaster Management Act states that the Disaster Management Center should collaborate with technical agencies, including the Ministry of Health, Department of Health Services, Epidemiology Unit, and Medical Research Institute in carrying out disaster mitigation activities targeting biological hazards. Apart from this, during our key informant interviews with subnational level disaster management authorities, we realized that subnational level disaster management authorities like disaster management committees and district disaster management coordinating units play a very important role in terms of coordination in preparedness planning for dengue, while the technical inputs are provided by the health sector. However, in certain districts, in place of activating the disaster management committees, subnational level dengue committees are activated, and these dengue committees, they function directly under the Ministry of Health. And a similar role was played by the subnational level disaster management authorities during the COVID-19 pandemic situation. And moving on to the key insights that we have derived from this section, authorities and stakeholders for emergency preparedness and response related to epidemics have been clearly designated in the National Emergency Operations Plan. And a considerable level of emphasis has been paid in national level disaster risk management plans in taking into account hazards like epidemics and pandemics, but this has not been implemented in the country to a significant level. And biological hazards have not been adequately addressed in subnational level disaster management plans. And also subnational level disaster management authorities have played a predominant role, like a significant role in preparedness planning for dengue in terms of coordination actually. But they said that they did not have enough technical knowledge for effective coordination with health, effective coordination. And also subnational level collaboration between subnational level disaster management and health authorities exist at a very field and operational level. Collaboration between these two sectors at a planning and decision-making level should be encouraged, especially when preparing for compound events. For example, if a flood occurs during the COVID-19 pandemic or a landslide occurs, etc. And last but not the least, our findings also show that preparedness planning for biological hazards has not been mainstreamed into the activities of subnational level disaster management committees and district disaster management coordinating units. So that's all for my presentation. Thank you.
Thank you, Ravindu and Naduni. So let us move into our last presentation. It's on current early warning systems and epidemics and pandemics, lessons from the ground level, current status and the scope. Let me invite Dr. Chandana Sirivardhana, who is a senior lecturer at the Department of Civil Engineering, University of Moratuwa, to make the presentation. Over to you, Chandana.
Thank you very much, Dr. Nichara. I hope you all can hear me. So let me move on to my presentation. The topic is the current early warning systems and the epidemics and pandemics, lessons learned from the ground level, current status and scope. This is mainly structured around the disaster risk communication, because at the end of the day, we need to communicate to the ground level in order to inform them what are the vulnerabilities they are facing. Some reason, give me 1 second, there is an issue here.
Chandana, can you share the screen, please? You have not shared the screen.
All right, okay.
Dr. Chandana, can you hear me?
Yes, yes.
Okay, now we can see you. Yes, thank you.
Right, okay. Right, yeah, that's what I also wanted. Okay, sorry about that technical issue. So The topic is the current early warning systems and epidemics and pandemics, lessons learned from the ground level, current status and the scope. So as I mentioned previously, it's about disaster risk communication. At the end of the day, if you don't communicate the vulnerabilities to the hazards to the ground level community, to the vulnerable groups, it is not going to be successful, whatever the structure we have in place. So let's moving on. So then we will be discussing in this presentation about the current national early warning system of Sri Lanka, disseminating early warning for pandemics and epidemics in Sri Lanka, and risk communication in pandemics and epidemics outbreaks in Sri Lanka, and what we have learned from this exercise. So the definition is given in the Disaster Management Center, and then it is very much in line with the international level definitions of early warning. So basically, it is not only about warning dissemination and communication, but there are other aspects which we have to look into. So they are mainly disaster risk knowledge, detection, monitoring, analysis, and forecasting of the hazards and possible consequences, preparedness and response capabilities. So without these three aspects, we might not be able to disseminate the information direct to the vulnerable groups. So like it is very important to focus on other three areas as well. So these are the currently available early warning mechanisms in Sri Lanka. So traditional media, and then the modern channels. Mainly traditional media, people rely having, like based on our research which we have carried out in the context of early warning dissemination in the multi-hazard early warnings. So we have found out that people generally relying more on the traditional channels than the modern channels like social media and the dedicated apps and so on. That is the main reason is people, the community, they like to believe the structured way of presentation of the information to them, because when there is a noise of many information available floating around, they want to rely on structured formal information. So that is why they are relying on newspapers or radio and television, even though there are a lot of other information dissemination modes available. So current early warning mechanisms system of Sri Lanka, mainly in other disasters or other hazards, Emergency Operations Center of Disaster Management Center, they are the mandated agency in the focal point, which is in the national level coordination and then dissemination of the early warning messages. And the key responsibility, I think Major General Sudhanta Ranasinghe has already presented this information, but we'll quickly go through them. Like maintaining and operating early warning towers and other early warning dissemination equipment, dissemination of early warning messages, and ensure the receipt of the remote vulnerable villages. So I think Major General Sudhanta Ranasinghe clearly explained that they have a very good structure in place where to reach to the vulnerable communities in the ground level. Coordination of donor assistance to strengthen capacity of technical agencies for early warning, working out strategy and policy in the given area of activity, initiating awareness on activities related to early warning among the various agencies and public, guiding district disaster management coordination units in coordinating and implementing warning dissemination related activities in the province, district, local authority, division, Gram Nildari, and community levels. So then this is actually the structure. So they operate in 4 stages: national level, district level, divisional level, Gram Nildari level. Basically, they have a very good infrastructure or the structure to reach the Gram Nildari levels, the community levels, and then they work with the community organizations as well. So it is a very good, very established structure. And they are the Disaster Management Center. They are working closely with the other technical agencies, and then in the Disaster Management Act, there are mandated technical agencies for each and every hazards as indicated in this table. So in this context, in the in the hazard early warning, so there are a meteorological department, and then the epidemiology unit, NBRO, irrigation department, and so on and so forth. These technical agencies, they have their own way of communication of this early warning messages. So they coordinate with the Disaster Management Center in these emergencies. When it comes to epidemics, it is given in the Disaster Management Act also, which was mandated in like 2005. So the national-wide emergency communication system has been established under the Disaster Management Center, and then epidemics is among them. Impending floods due to dam breach, rapid opening of sluices. Some of the other hazards are floods, so then the inundated areas, evacuation routes for safe areas, bomb blasts, explosions, chemical accidents, traffic congestions, important news flashes, and so on. When it comes to disseminating early warning for pandemics and epidemics in Sri Lanka, so then the Ministry of Health, as mentioned previously, are the technical agencies responsible for forecasting, issuing early warning messages pertaining to biological hazards like epidemics and pandemics. So Ministry of Health with the epidemiology unit, epidemiology unit and the quarantine unit are legally mandated to report to the WHO if there is an outbreak originated within Sri Lanka, and then also the epidemiology unit and then the quarantine unit are informed by the WHO if there is an outbreak in foreign countries. So basically they have the epidemiology unit and then the quarantine unit, they inform the WHO and then WHO inform them back. So there is a very good coordination in place. And if there is an outbreak in Sri Lankan context, as I mentioned, epidemiology unit of Ministry of Health generates the early warning messages. The message is issued by the under the approval of the Director General of Health Services. So this is the structure of how these messages would will flow down to the community level. So starting from the Director General of Health Services and to the provincial directors, and then the at the district level, the Regional Director of Health Services, RDHS, receives the early warning messages disseminated by said national level institutions, and then RDHS acts as the focal point for disseminating early warning to hospitals and then the MOH offices. Early warning messages are then conveyed to the communities via PHI and then PHMS. So basically, the Ministry of Health, just like DMC, they too do have a very good structure in approaching community levels. So basically, by having these two structures in place, simultaneous structures might be one of the reasons where community is being educated about these outbreaks, and then that might be the reason why we were successful in managing this pandemic. And moving on, however, so when it comes to pandemics and epidemics, one of the key informants informed us, like in case of pandemics and epidemics, the disaster management coordination units, they might not getting much involvement in disseminating early warning messages like in COVID or dengue. So in the risk communication in pandemics and epidemics outbreaks in Sri Lanka, so the main stakeholder in risk communication in health emergencies are the Health Promotion Bureau. We call it HPB. And however, HPB is not a technical agency, so they actually issuing the early warning generated by the technical agencies. There are regional health education officials functioning under the RDHS, and then the Suicide Health Net 24-hour hotline has been promoted among the public, and then the Emergency Operations Center at Ministry of Health is also there. They are working, I think, very closely with Disaster Preparedness and Response Division. So this is the risk communication in pandemics and epidemic outbreaks in Sri Lanka, the structure, which is the COVID-19 as a case point. So they mainly have risk communication systems strengthening communication within affected communities. And then especially they have not only the dissemination of information, since there are a lot of rumors spreading around in the case of pandemics and epidemics, what to drink, what the sources of curing this pandemic and epidemic. So there are a lot of rumors, and then that can create a panic among the community. So in order to stop that, they have to fight back, and then they have to monitor rumors, and identify, verify them, and then report them, and then manage them. So there is a special unit for that as well. And then for that, they do monitoring to 24/7 call center, mass media analysis, and then the social media analysis. They respond very quickly through various channels, and also the internal and partner communication and public communication. As you can understand, it's a very structured process. And also the risk communication in the pandemics and epidemics. So they work very closely with Disaster Management Center, as Major General Sudanta Ranasinghe mentioned. So the Disaster Management Center, they also work with the health authorities very closely, and then gave a very good support. And I think during the cyclone Buravi, it was very evident to the general public. So then we have seen disaster management officials working closely with the DPRD, Disaster Preparedness and Response Division, those officials going to the TV stations and educating general public, and also to with all the other agencies, other technical agencies like Meteorological Department and Defense Secretary and all that. They are having media briefings, so which is very much helpful to make the public aware not only about this COVID-19, but also the cascading impacts of other hazards like floods or Sena thing, or else these cyclones, and so on and so forth. When it comes to social media platforms, Health Promotion Bureau, they have a very good established Facebook and Viber communication channels, and as far as I know, they are the only agency from government having more than 400,000 followers with a verified Facebook page, and also they have use of public communication media to reach the village level, and then they have volunteer groups, and so they have hotlines and so on. So it's a very well structured way of communicating to the general public, reaching the vulnerable groups. So moving on. So however, we have identified several gaps in risk communication for pandemics and epidemics. There is a need of methodical risk assessment framework for pandemics and epidemics with the predefined risk levels. So mainly this is during the first wave, but with the time, I think most of these gaps were filled, and then we have identified that there were the way of disseminating information, there were gaps, but then with the time, with working closely with the other stakeholders, most of these gaps were filled. For example, this risk, now they are Health Promotion Bureau and then DPRD, they are producing the risk-based maps, so which is very timely, and which is very good initiative. And also this having an absence of emergency fund for risk communication is also, we have identified as a gap. And then having a lack of resources, technical staff who is capable of carrying out the technical aspects of this communication is, we have also have identified as a gap. The difference in target objectives of the stakeholders in different sectors. And moving on. So this is what I have mentioned as risk-based communication. So with the time, so they have now doing this communication, and National Risk Communication Plan to be established in 2021. I think they are working on it. There should be a risk grading system for epidemics and pandemics in Sri Lanka. New Zealand has predefined levels of pandemics and epidemic levels. However, an alert system was developed and published for COVID-19 recently. The risk communication should be identified as a collaborative effort, and it should cover all the levels of administration. Overall risk communication component should be embedded in the national disaster preparedness and response mechanisms, not only part of public communication. The reaching to the vulnerable groups should be more pre-planned, because we have seen some of the outbreaks happen, and then some of the tense situations will happen because of not like these vulnerable groups or the communities who are in the outskirts of this communication were not getting the enough information on or the enough directions. The capacity of the Health Promotion Bureau should be enhanced with, as I mentioned previously, with having more technical staff involved with that. So, and then the health staff also should be updated about the new developments continuously. And maybe there are other already available key instruments for early warning dissemination can be employed into this. For example, the Disaster Management Center already have this established this Dune system, and then maybe SMS-based platforms they can use. Social media they can use. Already they are using it, but it can be used. Might be able to use it more effectively. And early warning towers maintained by the Disaster Management Center. And there are new initiatives like which I thought better to highlight. So the flood forecasting and early warning system for the Kalu River Basin, decentralized early warning systems for landslides in Ratnapura, and UNDP initiative for strengthening early warning systems with special focus on last mile communication for flood affected areas. So with that, so we are reaching to the final slide of my presentation. So mainly, currently, dissemination of early warning for epidemics and pandemics is a health sector-led process. Existing early warning infrastructures can be further used to strengthen risk communication for pandemics and epidemics. There is a need for effective integration of pandemics and epidemics preparedness into overall risk reduction framework in the country. So with that, thank you very much. That is the end of my presentation.
Thank you, Dr. Chandana. Let us now start the questions and answer session. We got few questions. Also at the same time, we also have to finish this on time. So let me ask the first question from Dr. Herat. Sir, there is a question. The question is like this. It says, the person asks, can you brief us on the progress of establishing functioning of Health Emergency Operations Center in Sri Lanka?
Yes, Nishara. I hope you can hear me.
We can hear you.
Okay. Basically, our disaster preparedness unit is the disaster preparedness and response division is a dual purpose unit where when there is no disaster, usually we do our preparedness activities throughout the year without any break. We continue our preparedness activities, and when there is a disaster, we convert the same place into an operation center, and we carry out the operation or coordinating activities through this operation center. And at present also, this operational center is in operation. And this is basically a unit, I think, unique unit confined or to a civilian ministry other than the disaster management ministry, except the Triforces, police and other related places. I think the health ministry is the only one that is having an operation center of this nature. And this is basically a support one that is supported by several agencies, especially during the initial period. This was supported by the WHO, and their support is continuing throughout, and even at present most of the items, equipment and other facilities available in this place are provided by the WHO. In addition to that, many agencies such as the ADPC, where the Sisira is heading now, are also supporting us, especially during the initial phase of this COVID-19. We had to expand our capacity to accommodate the increasing demand, and they provided many things, including the computers and several other equipments that we were looking for, and these were very much helpful. And also, we are now in the process of expanding our emergency operations center network. We started with 1 or 2, but now we are having 7 basically fully functional emergency, subnational emergency operation centers. And currently we are in the process of expanding that into all 26 health districts in Sri Lanka, where each and every district is going to have a functional emergency operation center, so that whatever the emergency operations that need to be carried out, especially at local level, can be managed at that level rather than depending on a national level center. And that will be the part of our basic principle of disaster preparedness, where we are strengthening the periphery. And that's how we are going to make sure that they are much more effectively carrying out their response activities. Thank you.
Thank you, sir. The next question is to Major General Sudantarana Singh. The question is, how about percolating the technical knowledge to the bottom stakeholder with administrative officials as a key interface both ways? For instance, top-down and bottom-up. Do Sri Lanka focusing on these risk professionals in their risk management planning?
Yeah, thank you. Let's first let me tell you a little bit on the disaster management center layout. We have 25 disaster management district emergency operations centers plus the National Emergency Operations Center at our head office. And most of the officers who are holding on to district appointment, that is as assistant directors of the districts, are professionals and qualified and competent in their jobs. And most of these officers has gone through a lot of foreign training, has attended number of seminars, and there are certain officials who have attended more than 15 foreign programs and number of overseas and local seminars. And most of the people are competent and qualified in the subject of disaster management, the theory subject as well. To answer your question, it's not, I think, correct to say that they are administrative officers. They are not administrative officers. They are professional assistant directors who are doing the administration as well as they have the knowledge of their subject, and they have the foundation and they have the base. Further, we have professionals working with us at the highest level, so that we can always part with the professional knowledges. As you all know, we have Huddersfield University working very closely with us, then all the other Mortu universities, all the international agencies. So we have that highest level coming from you and Dr. Dilanthi and them. So they always share the professional inputs with us, so that we share it with our district officers, and district officers always implement them. But it's always when we make our national plans, when we make our district plan, we make sure that we incorporate all the knowledge and all the theories and all scientific and technical know-hows, whatever is being delivered to our officers, into action. Thank you.
Thank you, sir. So there are two questions. I think, yes, two questions for to Professor Dilanthi. Question number one. The question is, key actions for Government of Sri Lanka in collaboration with UNDRR and ADPC, working with University of Huddersfield. What are they? Please give us 3 actions.
Oh God, I think, of course, there are a lot of opportunities, and also I think, again, I have actually sort of seen a kind of a renewed interest in collaborations, and of course, I need to thank the Director General, Major General Sudantarana Singh for sort of promoting this new thinking. But having said that, I think it is not easy to pick up 3 areas actually, Nishara. I think what I suggest is, of course, tomorrow the Colombo Declaration will be launched, and it will identify, I suppose, very high level key directions of thinking in this field. So I think that will be a very good start, because I think it is very important that we need to identify issues at the same level rather than actually mixing strategic, tactical and operational level issues. So in that sense, I think it is not easy to pick up 3 areas, because if I just pick up 3 areas, then the issue comes, why not others? But having said that, I think from the top of my head, the key 3 areas is, of course, integration. I think Major General, I pointed out the point that virus doesn't have any boundaries, and I think I'll quote from Major General. He said, disasters come in packages. So I think which is very correct. So this integrated approach is very important, and also sort of linking science with policy. And also sort of being risk reduction and resilience in the agenda in line with the response agenda is important. So if I'm to pick 3 areas, I don't mind saying those 3. But of course, tomorrow there will be more issues, I think, capturing the kind of a cross-section of the subject. Thank you.
Thank you, Professor Dilanti. The second question is also, I think it's a very broad question. How to build multidisciplinary research capacity in disaster risk reduction in Sri Lanka? Who should be the key stakeholders and what should be the key research areas? Please give your views.
My heavens, I can actually talk for about 2-3 hours on that topic also. But again, I think the issue is, I think the multidisciplinary and the interdisciplinary aspect is extremely important for this topic. I think we all need to be working collectively. We need to be giving up our own discipline expertise, put them aside, and we need to be actually, we call it surrendering our expert opinion, and to come in a very collaborative way to solve the common problem. So for example, I think if I sort of take my own experiences, Nishara, maybe 20 years ago, I never thought that I will be working with historians, sociologists, engineers, civil engineers, medical professionals, and so on and so forth, because we used to have this tunnel vision. But now, we all are coming together to solve the common problem. And at the moment, it is the concept of DRR. So in that sense, that is actually the basic concept behind multidisciplinary and interdisciplinary working. For example, I suppose I can remember getting back to the 2014 conference of Disaster Management Center, there was very little involvement from the international and national academic community. But now see the difference this year. Everybody has come together. This is just a practical example. So that is actually very, very important. In terms of the subject areas, again, it is very broad. Perhaps to get a kind of a snapshot, I think it will be good to sort of follow the proceedings of tomorrow's final plenary, where the declaration will be launched, which has very high level key policy areas that if anybody can pick them up. So I was really pleased to see, I suppose we all need to be very, very pleased to see the development in that area in terms of so many people provided input, national, international, regional, and it covers, it is very, I'm sure there will be missing points. It's very difficult to address everything, but having said that, it will provide a really good roadmap towards DRR, taking DRR forward towards 2030. Thank you very much, Nishara.
Yes, thank you, Professor Dilanti. The one last question, I think Dr. Herath and Major Sudhanta Ranasinghe, even Chandana can, I mean, all 3 of you can, answer. So the question is, is there any plan for either from DMC, universities and Ministry of Health to engage end users, communities for research such as promoting the concept of by communities for communities? Let me repeat it. Is there any plan from either from DMC, universities and Ministry of Health to engage end users, that means, communities, for research such as promoting the concept of by communities for communities?
Well, if I am to answer, it's democracy. It's open to everyone. Gates are open. universities are there, even now they are doing it. There are no restrictions. Anybody can contact us, anybody can contact any universities. The Professor Dilanti is open, Bonoto University is open, health authorities are open, DMC is open. Why not?
Dr. Hera.
From the health ministry's point of view, we have been working, and our vision of the health sector strategic plan for at currently really we are ending this year, but the vision of this strategic plan is to resilient health sector for safer communities. So the community oriented vision is embedded in our strategic plan, and community-based activities are the one that we have identified as one of the strategic objectives related to this. And probably you are aware that many of our colleagues, including probably everybody knows Dr. Novil, who is a person who is working with the communities at different levels, and he is having a community resilience organization, and also he's working with faith related leaders and several other type of grassroots level operators. And these activities are carried out, and they are there in our plans. But however, that needs a reciprocal approach where we are prepared to provide the support, but the community also need to be induced to carry out such research or related activities. So whenever there is an opportunity or somebody comes up with it, we will be supporting. That's our policy, and we have the plans as well in our strategic plan. Thank you.
Thank you. Dr. Chandana?
Yes, Dr. Nishara. So actually, we as the university academics, so we go to the community level, and then for the we get the fair feedback for our research project. So then we collect information from the community level, and then we work closely with that, as Major General Sudanta Herat and Dr. Sudanta Ranasinghe and Dr. Herat said, we are working closely with these agencies. So then we bring back this information to these national level organizations. So then we actually doing that. So it can be further strengthened. At the moment also it is happening, and then we for the publications also we disseminated information to the to the scientific communities in a broader level as well.
Nishara,
can I just add?
Yes. I
think this is actually a practical example, as Major General Sudanta Ranasinghe said, where the Disaster Management Ministry, the university, the international audiences, and the Ministry of Health have come together in doing this research. I think what is key is in terms of communities, I think we all need to be actually having them on board from the beginning of the process, rather than actually getting them on board at the very end in terms of dissemination. Because then I suppose it doesn't become evidence-based, and that is what exactly the DMC, the ministry, and of course yourself, Chandana, have been doing, having the community level input. You went up to the community level at various districts to capture that information, because I think you need to actually have that representation from top national level to the community level. I think that is very, very important. I think this is a kind of a living lab, in my view, where all these communities have come together, and to sort of the community input is definitely there. So only thing is, I suppose in Sri Lanka, maybe what is lacking is, I think there need to be more noise about this type of initiatives, and to share the findings with a lot of audiences. I think that needs to be done. Maybe I think this impression perhaps maybe due to that lack of making noises in terms of about these collaborations that is taking place. I think maybe sort of, I think that is something that everybody can look into as a group, and I think it is happening. And I think I see that as a very, very good direction of travel. Particularly, all the communities who are part of this session. I think DMC, the universities, the Ministry of Health. I suppose what else need to come, and also as Major General said, the doors are always open, and I suppose we all have the open door policy, haven't we? I suppose. Yes. Thank you very much.
Yes. Thank you, Professor Dilanti. So with that, I have to close the session, but before that, I would like, as the session chair, I would like to thank Major General Sudanta Ranasinghe, the Director General of Disaster Management Center, Sri Lanka, for his participation and valuable contribution to the session, and also Dr. Hemanta Hera, the Deputy Director General of Public Health Services, Ministry of Health, Sri Lanka, for his valuable input to the session and also support extended to the study. And also, I would like to thank Mr. Sunil Jaivira, Director Preparedness and Planning, for the immense support extended throughout the project. Thank you very much, Mr. Sunil. And Dr. Chandana Sirivardhana, Senior Lecturer, Department of Civil Engineering, University of Moratuwa, Sri Lanka, for his active contribution to the project and collaboration with the project team. And Professor Dilanti, Professor of Disaster Risk Management at the University of Huddersfield and the co-director of the Global Disaster Resilience Center, for her leadership, guidance. Thank you, Professor Dilanti. And also, I have to mention Professor Richard Haig, the co-director of the Global Disaster Resilience Center of the Huddersfield University, for his cooperation. And I also would like to thank Ravindu and Naduni for their untiring effort to complete our research work on time, and technical team for their technical support. But last not least, all the participants for actively taking part in the event. Thank you very much.